Sometimes I feel like orthosis skills, creating custom fitted splints, I feel like that skill is a dying skill set. And I want to talk about why it is still so important to develop this particular skill. Now, my name is Huang. I'm an occupational therapist and certified hand therapist, and I have worked in just about every single setting: home health, skilled nursing, acute care, and then, of course, an outpatient. And most people think of their splinting skills as a skill that's required in outpatient. And while that is majority true, you're going to have some instances where your patients in home health need splinting. I've brought my little splint pan, it's just like a little skillet, and I've made some splints in someone's home. In a skilled nursing facility, you might have patients that need splints after a stroke. People fall and have distal radius fractures. Some people fall and have elbow or shoulder injuries. And so understanding when to use splints, how to use splints, when to get rid of splints, how to adjust splints, I think that it's so important even in a skilled nursing facility. And then I developed a lot of my splinting skills in acute care. I worked in a big hospital, and we saw a lot of acute types of injuries, and you had to make these big splints that are over bandages, or once they remove the bandages, you're making a splint, like real post-surgical stuff. And so those skill sets are really important. Oh, if you work in burns, that's considered acute care as well, and you make tons of splints in burns if you're working in a burn facility or anything like that. So and then you can get a lot more specific once you get into an outpatient hand therapy setting. But this is a skill set that is so important to develop and to practice, just like anything else. If you practice on it, it's going to get better, right? It's going to get better. But here's why I think here's why I think it's so important to consider to develop this particular skill, right? So for one, certain surgeries require certain splints at certain times. I'm going to give you an example. Flexor tendons need a particular dorsal block splint. Different types of extensor tendons, depending on where the injuries are, require different types of splints. Hand fractures. I just got a case last week where it's a metacarpal fracture. So it's not just a boxer's fracture, but it was a crush injury. So it was this knuckle and then the fourth metacarpal as well. And he came in a post-op splint that was just kind of keeping him pretty straight. That needs to come off at day 5, and a custom fitted orthosis, aka splint, needs to be created to position him in a way that will help support the surgery, but also facilitate motion. You can't buy that on Amazon, right? You have to be able to make it. So the MP has to go into a flex position of 60 degrees. And as long as there's nothing going on over here, we can leave that free. Now, you might have some cases where something else is going here and you need to make that long. It's called an ulnar gutter splint, but sometimes it needs to cover the eyepiece. Sometimes it only needs to cover the MPs. Sometimes it needs to cover the wrist. And this is why developing your orthosis skills, like creating these custom fitted splints, are so important, because certain surgeries require certain splints. And that's how you're going to help your patients get better results. You're going to look good doing it, okay? So that's number 1. Number 2, not every patient fits into a prefab. I have patients who come in, they're like, I ordered this on Amazon. They'll buy something for like $9.99, and it's because it's cheap and it doesn't work. Sometimes it can, but I had a complex PIP fracture who she had developed a contracture already. And so they're like, oh yeah, they showed me the splint they got. It's like a Velcro thing, and it was horrendous, right? Because people are just buying shit online because it happens to be cheap and it's affordable. But the most important thing about making a splint is actually your problem solving skills, right? It's actually up here. This is why you have a degree. You have a degree. Most of y'all people have a doctor's now, right? I have my master's, but we have the ability to critically think through the problem because we understand the nature of the injury, we understand the nature of the surgery, and then we know splinting principles. And if you don't, you should come to a class. You can pick any class, but I do have an orthosis course coming. You're just gonna have to check my link for my events page. So I'll include it here because I don't know when you're gonna see this. But I don't usually host an orthosis workshop, but I am doing it this year. It's 2025. If you're watching this in 2025, if you're watching this later, who knows? But it is, it's not easy to put on the class because you need the space, you need the hot pans, you need all the materials and things like that. But if you can find a course that you're willing to go to, that fits in the time frame of wherever phase you're in, really consider taking a live course. I have an online course where I send the materials to you and everything, but there is a lot of value to coming to an in-person course as well, because within those 2 days you can do a ton of different splints and you're getting that practice. Because not every patient fits into these prefabs. I had okay, so for example, a wrist support splint. Everybody and their mother's got one of those, selling those. You can have these custom fitted ones that come from these big companies, and then they're kind of molded to you. Somebody's still molding it, and they still have to understand the principles of splinting, but they're also still prefabricated to fit a certain way. And I had this one woman, she was a little bit overweight. She was a short little thing, but she was overweight, and she had the tiniest wrist. I can't touch my fingers. I could touch my fingers and like go across it. Her wrists were tiny. Her forearm, big, right? She was just a little bit bigger, right? So all the splints that they kept trying on her did not fit and did not support her wrist in the way after surgery. So not all patients fit into these prefabs, and not all of them are using them correctly. And so this is an opportunity as a specialist, as an occupational therapist, as a physical therapist, as a certified hand therapist, for you to really develop the clinical skills, not just of problem solving and deciding which ones you need to go into, when do you go into it, when do you get out of it, but creating it like with your hands, right? Because not all patients fit into a prefab. So the third thing that I think is really important for why a therapist, should continue to develop their clinical skills in creating custom fitted orthosis splints. This allows you to be even more specialized. And I think when things are in the world becoming so inundated with information, cheap things that people can do on their own, people are watching my videos to learn what to do for themselves, just like you're watching my videos as a therapist to learn what to do. So as a therapist, in order for us to be more specialized, I need to understand things at a higher level than my patients are coming in, because they're looking to me as an expert to guide them, right? I mean, think about it. Surgeons don't do their own surgeries, right? Like, you can't do it to yourself all the time. So when you develop your orthosis skills that are paired up with your clinical skills, like clinical reasoning and your manual skills and your whatever skills, working with very specific injuries, splinting skills allow you to be more specialized. You can become the expert in this area. You can be the go-to person in this area. And I don't care what setting you work in. When I started in OT, because I had such an interest to become a hand therapist and I wanted every single opportunity to make splints, everywhere I went, I was like, I'll do it. My shit sucked. I can still do it, right? I can still, even sucking, I was better than the person unwilling to do it. So in a skilled nursing facility, in your setting, you might be thinking about different ways to prevent hand contractures, wrist contractures. some of your chronic stroke cases can't fit into a prefab, um, spasticity splint, right? You don't have to do the whole thing by yourself. You can buy a prefab and then adjust them to fit your patients, because some of these people, they develop more hand, deformities because they're placed in splints that just don't fit them. So in a skilled nursing facility, you can now become the expert of the person who knows about splinting, positioning, and helping prevent hand contractures. Boom. You have a specialty in hands in your setting. If you're in acute care, so I went from a skilled nursing into acute care, and at that time, my supervisor was an aspiring certified hand therapist, and he spent a lot of his career making splints, and he taught me. And so he was a go-to person, and then when he taught me, then I became the go-to person, right? Then anytime there was a splint anywhere in the hospital, it was a 500-bed hospital, they called me, right? So I got to, because I raised my hands, like, I want to develop this particular skill. Anytime there was one, they called me. And so I had an opportunity. I'd take my little, in acute care, you have to be mobile. So I had one of those splint cards. And we just stacked all of our stuff on there, and we would roll into the patient's room. And I saw some of the most complex elbow cases, wrist cases. I was able to make mental braces, like for someone who has a humeral shaft fracture and they needed that because they couldn't order it fast enough. You needed a custom one because of the way the arm was positioned or because of wound care stuff, so then we were able to make like custom fitted ones. And it just allows you to become the expert in the setting of your choosing. I took that particular skill, and because I was able to make splints, I was able to move into an outpatient setting. So then when I was in the outpatient hospital setting, again, I was still the go-to person. So anytime a splint needs to be made, whether it was in acute care, in a rehab, I could go and help. So I started, actually, funny enough, I started teaching in the hospital. Like, I would put on these little 2-hour seminars, and I would teach some of the therapists there how to, make simple ones that they make most often. I would teach them how to check on the skin and how to educate the patients on what to do. And that's how I kind of got my start in teaching, just because I was really interested in splints. And it was a skill that I thought that everyone always would tell me, what are you thinking when it comes to splints? When I started talking about this video, oh, they didn't really teach me enough in school. We never really did enough. You can't do enough in school. You can't do enough of anything in school. It's just generalized information so that they teach you everywhere. So school can only do so much. You have to do so much more once you're out of the school based on the setting that you're in, right? So a lot of times people are like, oh, school didn't teach me enough. Oh, I don't have, I don't get to make too many. I know. This is why you want to develop this particular skill. If you don't do it a lot, then you have to find opportunities to get that practice. Finding opportunities to get that practice includes buying materials on your own and just winging it. You can do that. There's nothing wrong with doing that. There's enough videos online showing you buy a thing, try it out yourself, right? That takes a lot of time, and you can waste a lot of time too. Two is you can take a class. Pick an online class. There's a lot of classes out there. You just have to look for them. If you're finding me right now, I am teaching a 2-day orthosis workshop in Miami this year, 2025. It's going to be September 27th and 28th. I rarely do orthosis workshops anymore because I teach a lot more manual, and I spend a lot of time helping therapists become certified hand therapists. But fundamentally, I think that having and developing this particular skill being able to create custom fitted orthosis is within the wheelhouse of becoming more of an expert, becoming the go-to person, being able to treat any case that comes your way. Your patients are going to come to you and they're going to be like, should I do this? Should I do this? And you want to be able to speak on it. If someone brings you a a prefab, you should be able to look at it and say, oh, this works and this doesn't work, and this is why you need a custom one. Oh, or you can say, oh no, that works perfectly. Maybe make these few adjustments. Maybe wear it on this time, and get rid of it by this time. Right? This allows you to be an expert of the hand and arm types of cases, the questions that people have about splinting. So please, I beg you, if you're working with anybody with 2 hands and 2 arms, really consider honing this particular skill set. Again, I am teaching my course this year. I'm going to include the link for you, but if you can't make it to Miami for that weekend, really consider finding a course like this. It is going to help you get better results for your patients in general, right? So yeah, I'm going to include the link below. We are going to, in my course this year, right? If you're watching this in another year, can't help you, but we're going to be making bigger splints that I think that therapists don't have an opportunity to make. And so this allows us to practice, right? Elbow orthosis, sugar tongs or Munster splints, hand wrist splints such as a dorsal block, a thumb spica. I have to figure out those two still. I think that there's very particular set of skills for each one, and once you learn it, you'll be able to take it to various splints. For example, an elbow splint, there's a way that you cut and round your corners so that you can fold it and it can fit, right? And you need that for the elbow. You need it for the dorsal block splint for how do you call it, a flexor tendon. And that same skill set is used when you're making a small dorsal block splint, right? For like a metacarpal injury or something like that, or an MP injury. So those three, so I'm dedicated, my goal of the class is to teach very particular skill sets within the splint making world that you can then apply. Once you learn that skill set, you can apply to various types of splints. Your skills can be compounded. I call it stacking. Once you learn it for over here, you take that and you stack it to the next, to the next, to the next. That way, not everything needs to feel brand spanking new and like, oh my God, I can't do it. I want to make it easier for you to be able to develop the skill, but also to be able to practice, not just in the 2-day workshop, but also to take it into whatever setting that you're working in. So, and then we're also going to, between the big splints, the medium splints, and then the small hand-based splints, we're going to hit all three, sizes, right? And then one thing I always do in my splint classes is I teach you how to use plaster casting. I have started to use a lot of plaster casting for PIP, DIP types of issues. Started doing it over, over 15 years ago. And it has really helped me with some of my injuries, not just finger injuries, but I've used it in different ways to progress in my treatment. Anyway, if you're interested, I'm going to include the link below. And there's only 15 seats. Actually, I'm sorry. There's only 14 seats. So, first come, first serve, and it usually fills up. All right. So if you have any questions about the workshop, just sign up for the information and then send me an email, or you can leave me a comment, whatever's easier. All right. Let me know. I hope to see you there.